This is Dr. Corey Maas on Looking Your Best. We've had a lot of questions in the last few weeks about the new ways of weight reduction, weight loss, and of course the hyperbole in the media about what was called Ozempic face, and there are several different semaglutide products out there on the market, all of which cause rapid loss of fat by tricking the body into making less insulin, which is the main insulin producing, the main fat producing molecule in your body. And I mean, to keep the summary short and how it works, the simplicity is basically it shuts down fat production. It requires, of course, that you do, like any kind of weight loss program, that you do reduce caloric intake. You get a little less hungry because there's some nausea associated with taking the medicine. And it's done once a week as a injection and administered appropriately. It's a phenomenal way of getting a lot of Americans out of the obesity, diabetes, and hypertension cycle that is so prevalent in our culture, really. So, but it's only a beginning, and like I said, it includes a diet and sort of some type of an exercise program. It's always about calories in and calories out. This is something that we don't offer in the clinic, but we have the Med Spa, which is a multi-owned facility, and a nurse practitioner that runs our weight loss and body shaping program, who is working with this as well as a number of other different products that can help with getting yourself in the best fitness shape that you can get in. And a lot of that starts with just losing fat and getting on a good diet and having a decent exercise program. So it doesn't require calorie counting. This is a common misunderstanding, I think, from many people, that you have to do calorie counting. Probably the simplest way to go on a diet is what is often referred to as intermittent fasting, where you just stop eating after some set period at night, say 7 or 8 p.m., and don't resume any caloric intake. You can drink lots of water and coffee, things that don't have sugar or any kind of calories in them, up until the next day, sometime around, let's say, 10 o'clock, 11, or noon, which would be a 16-hour fast. If you get into the 16-hour range of fasting, you're already burning glucose, and you've already burned through your glucose and started burning fat, which makes you ketotic. That means you're breathing off some of the metabolic products of fat burning, and you'll see a lot of rapid weight loss. So if you have any questions about that, don't hesitate to write me at drmaas.com on our video blog. You can reach out through Instagram at Dr. Corey Maas, or at my Twitter account at Dr. Corey Maas. We have lots of comments, and there's certainly a lot of questions about this program. But again, it's focused on fat reduction with molecular or medical help, along with exercise and diet. And any program that is just this, which is a big problem in LA, where they have many people in line to get it without significant weight problems, and that's created somewhat of a shortage. But if you have any questions, don't hesitate to call or write me at drmaas.com. It's my pleasure to help you look your best.